So my name's Deanna. I'm 29 now, but when I turned 26 going on 27, I started noticing some kind of symptoms like I lost my appetite, I lost about 30 pounds. I wasn't able to even hear, like there was always a ringing in my ear. And then, it progressively started to, irritate my eyes. Like the sun would basically make me feel like I had sand in my eyes. And then eventually it got to a point where I was getting dizzy and falling on the ground. And at that point, I knew there was something serious going on. But, every time I kept going to the hospital, they kept telling me that I was either stressed, didn't know how to cope with life. They even, suggested that I was probably pregnant, and then I told them no multiple times. And then until one day, I actually got very into it with a doctor because he kept saying that I was just misbehaved because I wasn't, giving him eye contact or just um paying attention to him because I would always like ignore him and like look away, but it was just like my body naturally did that and I didn't have control of it. And so he kind of was just like, well, I'm gonna show you that there's nothing wrong with you and that you're just having like a nervous breakdown. I'm gonna do a CT scan of your brain and show you that, there's nothing wrong. And then I want to say about like 10-15 minutes later, he comes running and he's just apologizing and he's just like, I'm sorry, but we're gonna actually have to transfer you to a different hospital. At that moment, I didn't know what was going on because I was on a lot of drugs. I was The headaches got really bad to the point where, I started using stronger drugs to like numb the pain, and every time my body just became more intolerant to the medication that I needed something way stronger. So I was very like not in a good state at that moment. So I was so confused. I just knew that I was in an ambulance. I was going to another hospital. And at that point, it was just a bunch of medication on top of medication. So I don't remember too much about finding out that I had the tumor. I just knew that there was something wrong with me and that I needed to get surgery done. And then, those moments where I was, you know, not under so much medication, they would come and talk to me and just tell me, hey, there's a possibility that after surgery, you're going to have some kind of facial paralysis, but the chances are very low. So, I believe they told me it was about 13%. And I didn't think 13% was, a lot. I just thought like, yeah, like, it's like 13 cents if you're considering a dollar. It's very minor. But when I woke up, that's when I saw everything. And, you know, I was a little bit better at, I was more conscious of what was going on. So they did talk to me and they told me, hey, you have um, an acoustic schwannoma. And what it did is it irritated your facial nerve. And when we were doing surgery, um, the tumor was wrapped around that nerve and it damaged it, and we weren't able to completely remove the tumor. So that caused the facial paralysis and the muscle weakness and just the headaches. And I was just like, okay, what happens now? And so I went to a neurosurgeon in Providence. I believe her name was Tiffany Avila. She was the one who was like, I'm sorry that they didn't really guide you like after your surgery of what was going to happen or what needs to be done. But I know this surgeon, ENT. At that time, I thought it was an ENT, but I wasn't too sure what Dr. Kochhar's title was. They just told me this doctor's gonna help you with like the face stuff. And I was just like, face stuff could mean like physical therapy or just something to help with that. But they're like, no, he's gonna help, he deals with a lot of facial paralysis, so I think he's gonna be better for you to work with. And so, I went to Dr. Kochhar, and then at that moment in my life, I wasn't as motivated or healthy in my healthy mindset. So Dr. Kochhar did tell me like, hey, you know, there is a chance for you to be able to smile again, and we can do something about your eye and about your nose because um, when I slept, my eye stayed open, which caused like dryness, and my eye was like losing my vision slowly because it just got my eyeball got really dried up. And then I wasn't crying through that eye, so there was nothing to keep it lubricated. So I had to do, ointments that didn't really help, but you know, I had to do something to, keep my eye moisturized. I wasn't able to breathe in my nose that well because since my nostril did get like some way, it doesn't like flare up when I'm either like walking around or doing something very fast. Like it just feels like there's a lot of like mucus in there, and like my other nostril started to like hurt. And so I was just like, okay, I just had to constantly do something like breathe or get like a humidifier and then like put it under my nose. Um, then like my mouth, since it wasn't like closing or moving that off, I was having trouble talking. I couldn't eat because the food was always coming out. And, when people talk to me, I was always like slurring my words. So it wasn't, a fluent conversation. And then, I got the total hearing loss, and I was just like, okay, like, I don't know how this doctor is gonna help fix all of that because, it was 9 months of me just going and dealing with that. So yeah, when Dr. Kochhar told me, we'll be able to help you out, I didn't believe him at that point. I was just like, it didn't get better. It's not gonna get better. So this is what it is. And anything you would tell me, it was just, you're trying to motivate me or in some way like encourage me and hope for the best. Even though at that time I didn't know, if he was gonna do something. And so I had to, I was a little like discouraged, but my boyfriend at that time, he was just like, just try it. Like, it doesn't hurt to try. Because you don't want to be like 10 years or 15 years from now saying, like, if I would have just tried the surgery, maybe, like, something would have been, prevented. And so, yeah, him and my sister, they're just like, do it, do it. Like, you don't know what to expect, but at least you're trying, right? And so I was just like, okay. And so I did go for, Dr. Kochhar to do the consultation and everything. And it happened so fast. I didn't really have time to process what was going on because he went in, all right, we're going to schedule you for, surgery. So we're going to do an eyelid weight to close your eye. We're going to open your nostrils so you could breathe a little bit better. And then we're going to do nerve grafting, which, we're going to take a nerve out of some part of your body. It was either my calf or my neck. And I chose my neck because I still wanted, sensation on my leg. And so he said, we're going to replace it, and then we're going to be able to make you, chew down and smile. And so I was just like, okay, you're saying all these things, and I'm just doing what's being told. And I woke up the next day, and everything was just swollen. And I was on so much drugs, a lot of drugs, and it was just like I felt worse than what I had, was already going through, because I just felt like after surgery, it's just waiting. And the waiting part was a little stressful, because like I didn't see anything. Like I was healing, the scars were closing up, but nothing was moving. And so I was just like, sorry, let me turn this off. And so eventually, I want to say 3 months after the surgery happened, I went for follow up, and Dr. Kochhar just was making sure everything was okay. He said everything is great, like the surgery went like smoothly, but like I didn't see anything. So I'm like, what went smoothly? Because I don't see it. And so just said, give it time, do therapy, and you just have to wait. You just have to keep stimulating your muscles until, the nerve starts activating. And so I want to say after the 5th or 6th month, I started to notice my mouth twitch a little bit. And he said, every time you bite, it's going to move. So just keep practicing. And so that's what I did. I kept, chewing down my eyelid weight. It helped after it healed. I actually had to go back again because it wasn't strong enough because my eye was still open. So he went in again and he put a heavier eyelid weight, and that was help. That's the one I have now, and that one's a lot better than before because I was still talking. People were like, "Your eye's not closing," or "It's not closing all the way," and I was just like, "Okay, I think I need a heavier one." And then my breathing, I mean, it's a lot better now. When it's very like stuffy or like hot, my nose still gets a little you know, congested, but I'm able to breathe better through my mouth. But my mouth, it still wasn't moving at that time. It was barely twitching. So I want to say after 9 months, I was able to like show my top teeth, and I was like, okay, it's finally, starting to work. But I didn't know that there was still gonna be more movement, because I was just like, as long as I'm able to move a little bit and show my teeth, like I'll be happy. But Dr. Coach, I was just like, no, like you still need to keep practicing because your mouth can move all the way if you really, work on your smile. And so I was just like, okay, like I'm already a little content with what's going on. Like ideally, I would want to have like my natural symmetrical smile without me having to, force myself to smile. But it got, I want to say now it's a year and about a year and like 3 months after that. Now I can smile without biting my teeth down, because before it was like you had to bite and then close it. And now I don't even have to bite, and I could just smile without, biting my lip, or biting my or closing my mouth.
I
So,
didn't get that. Could you try again?
so I'm still, practicing with my smile, and I want to say now it's about 2 years, and like 2 years. I want to say it's 18, 19, 20, 21, 22. Oh, 4 years? It was 2019, so we're in 2022. So about 3, 4 years now, and this is where I'm at now. So it did, you know, from when I first saw him to now, I can see how much improvement my face has. Even like the people around me, they're just like, it looks like nothing happened. Here and there, I do have my moments when I'm tired, like you could kind of see it a little bit more. But if I'm just like constantly taking care of myself and making sure, my face stays active, then people don't even notice, I have the facial paralysis. So that's how I got to know Dr. Kochhar. I want to say, I mean, breathtaking is one word. It was a something that I didn't expect. So, and it was also like a divine, movement, seeing myself progress from that very insecure state to watching myself become a little more confident in myself than what I was. So it was just a very, you know, I would say it was a inspirational experience.